If you work for LinkedIn, odds are that you're sleeping in this morning. I'm jealous. The business networking site gave nearly 16,000 employees worldwide this entire week off. The initiative is meant to combat burnout due to the pandemic. Researchers say that stress and exhaustion among office workers has worsened during the coronavirus crisis. And to talk about burnout during the pandemic, we are joined by Dr. Wendy Dickinson. She's a psychologist and the founder and CEO of Grow Counseling. Wendy, thank you so much for taking the time to chat with us this morning. Should more companies do what LinkedIn did? Is more vacation time what's needed to tide us over until we're fully immunized?
Well, I think if companies can do it, it's a fantastic thing to offer to employees, not just because as we help with their mental health, their productivity goes up, but also just to show that they care about them and they want to invest in their lives. What we know is that stress over time becomes crisis, and then crisis over time becomes trauma. And so if we don't interrupt that progression, we will find people in a state of trauma. And so what they're doing is they're jumping in early. They're saying, hey, take some time off, engage in some really good self-care, hopefully with the intention of decreasing that progression.
And how does pandemic burnout differ from typical burnout?
So burnout in general is characterized by a deep sense of fatigue. So it's not just being tired, it's being completely exhausted across a number of levels. You may see depression and hopelessness and irritability. You may see physical pain. I think what makes pandemic fatigue really unique are a couple of factors. One is that it's pervasive. Every area that we're facing, going to the grocery store, working differently, engaging in relationships differently, all of these things are pervasive and it's really unique. I think the other factor that makes it really unique is the level of disconnectedness that we're experiencing. So of course, during quarantine, we were less connected with people, but even since then, our abilities to connect with people have changed given what our circumstances are. And you have to remember that isolation is a form of torture. And so, people are really living these very disconnected lives right now. And I think one of the things that we have to do is we have to make sure we're getting out of a rut. Now that it's a little safer, now that the guidelines have been lifted, and now that people have gotten some vaccinations, it's really important to get out of that rut of disconnection that we have found ourselves in for the last year.
Yeah, there's finally a glimmer of hope. But, for many of us around the country, first responders, journalists, perhaps, we haven't really had a chance to take some time off and really recover from the burnout. So what do you recommend for people who have jobs that are so demanding, not very flexible in the sense that they can't take large chunks of time away from the gig?
Yeah, absolutely. I'd say do what you can. So even if these are kind of micro moments of self-care, find times throughout the day to disconnect from social media, even if it's for 5 minutes. Go outside in the sunshine, take your shoes off, stand in the grass, take a deep breath. These micro moments of self-care can be really restorative if we're intentional about engaging in them throughout the day. The other thing I would say is I would circle back to connection. Make sure that these connections, these relational connections that help insulate us from the negative effects of stress and trauma, that you're re-engaging with them to help balance out some of that stress that you're carrying. And then the third thing I would say is reach out and get some additional support, some help. There's some great options for therapy through virtual sessions, phone calls. You don't even have to leave your office to go get some additional support. But having a professional that's on your team can be really helpful.
I want to hone in on one thing that you said earlier, which is that the stress and the burnout, when going on for too long, can lead to that trauma. Even when the pandemic ends, hopefully this year, let's just pray, we will be carrying this experience with us for a long time. Does PTSD factor into this, even if we've just been cooped up inside?
Absolutely, it does. One of the things that is really interesting about PTSD as it relates to the pandemic is that PTSD is a threat to, we experience PTSD when we experience a threat to our safety. So it's firsthand, but it can also be secondhand. So it can be a threat to someone's safety whom we love. And I think most of us at some point during this year have experienced threats to safety of those people that we love in our lives. And so I think that we have to start thinking through this through the lens of PTSD. Not everyone's experience may be as extreme as that, because you may have had factors that help insulate you or offset that. But the recovery from this pandemic is going to be more like a marathon than it is a sprint. We're all going to need a professional on our team to help support us if we can. And I think really being thoughtful and mindful about the recovery process is going to be important, so that we make a full recovery and we don't stay in a pseudo state of PTSD long term.
Some really important information, Dr. Wendy Dickinson. Thank you for your time this morning.
Thanks for having me.